Do skin cancers appear differently in skin of color as compared to white skin? What should people of color look for? We have found some interesting differences in skin cancer appearance across the different patient populations. And this differs for the various types of skin cancer, like basal cell carcinoma, which is the most common type of skin cancer, squamous cell carcinoma, and melanoma. For basal cell carcinoma, the classic presentation is that of a pearly papule or a pink bump with rolled borders and really prominent blood vessels. Now, this is the classic presentation in fair skin. However, in darker skin, basal cell carcinomas tend to be very dark and brown, meaning that you can't see its pearly color and you can't see those dilated blood vessels that run through the lesion. This can pose a challenge to physicians who may not be aware of these nuances that may occur in patients with darker skin. Squamous cell carcinoma is the second type of skin cancer overall, but it's actually the most common type of skin cancer in Black patients. Compared to white patients who tend to develop squamous cell carcinomas on the head and neck region, Black patients tend to develop them on their lower extremities and in the genital regions. Melanoma, the least common type of skin cancer, but also the one that's the most deadly, also has some variations in clinical presentation. Like squamous cell carcinoma, melanoma in minority patient populations tends to happen in sun-protected areas like the lower extremities. A specific type of melanoma called acrolentiginous melanoma tends to occur on the hands and feet, the nail beds, and also occasionally in the genital area. So it's important for both patients and physicians to understand these differences across patient populations so that we can be aware of these differences, know what to look for, and treat and manage accordingly.